Hi, this is another episode of We Are M&R. This is Thomas Tringham. I'm the Marketing Communications Manager for M&R Companies. And today I got the great fortune to have my good friend Amarish Dave here from MercyHealth. So Amarish is going to share some tips and some different things that can help us with information related to the COVID-19. Why don't you start off by telling our audience what it is you do on a day-to-day basis there?
Sure. So I'm Dr. Dave. I'm a board certified neurologist. I've been in practice about 17 years in Illinois. And for the last couple of years, I've been also the associate medical director for MercyHealth. And so I see adult neurology patients, but for the last few months, been involved with some of the strategic planning for COVID-19 and how our organization has been planning and responding to deliver healthcare during this crisis. As a part of that, of course, is how to guide and direct patients to do what we can to, maximize their safety for those that don't have it, and of course, how we manage care for those that do.
Yeah, that's amazing. I can't imagine this is a challenging time for everybody. And can you just give the audience just a little bit of your background as far as your medical expertise and that sort of thing?
Yeah, so as I said, I'm a board certified adult neurologist. So neurologists are not necessarily, at least during this crisis, at least in the short term, directly involved with managing the critical illness. This is usually more for, the emergency medicine doctors and intensivists, pulmonary physicians, et cetera. What I've been trying to do is gather the information from the infectious disease specialists and pulmonologists, et cetera, and break it down into sort of reliable information for my patients and the community at large to make it so it's reliable, consistent, understandable information that's not overly alarmist, but also not dismissive, so that they feel like it's coming from trusted sources. I like to say, during a storm, you don't want some guy going on the internet and finding out how to fly a plane. You want the pilot that's got 20 years of experience to navigate you through that storm. And during this sort of what's probably once in a lifetime pandemic, the scientists and doctors and public health officials are your pilots. And we should rely on those people to help us navigate through this. And yeah, there may be some differences of opinion, but if you take 95% of them, I think most of them and us sort of agree on many of the recommendations. So I try to take the majority of those recommendations and break them down into understandable bits of information that we can all apply in our lives.
Yeah, that's great. So in our industry, primarily we're involved with apparel manufacturers and apparel decorators. So people creating t-shirts, garments, different types of clothing for people, and a lot of it has to do with promotional items and that sort of thing. And of course, right now that industry has shut down by and large. To some degree, there are some essential companies open that are providing. They've switched their manufacturing. They're providing masks and different things. Maybe like out of the gate, like what would be some information you could share right now for a lot of these people that are, staying home? Like how can they, kind of lessen their risk or maybe be a little safer, that sort of thing? Just general like things they can do.
Sure. Well, a lot of these, guidelines, I think from the CDC, even though some of it's changing, are still really important. And some of the basic ones, I think most states, certainly here in Illinois, is inconvenient and disruptive as they are, at least in the short term. And I would say, as of today in early April, we're sort of still in that sort of rising peak phase. This sort of social distancing, or maybe a better term is physical distancing, because we don't want to be socially disconnected, but physically we want to be separated. And I think that's a better term to use, is important, because that definitely can cut down our transmission risk. I think if we do have to go out to get groceries and things like that, probably one family member should be designated to be that person. I would recommend, I know I do when I go to the grocery store, I do put on a mask when I go to the grocery store. I wipe the cart. I wash my hands as soon as I walk in the door before I even put away the groceries. I walk into the nearest sink. I wash my hands with soap and water. So before you even enter the house, we all should be washing our hands. We just prevent spread to the rest of the family. Those are certainly two things from an infection standpoint. I think also from a mental health standpoint, because these are really stressful times, especially when we're not used to being at home. Dynamics are different, not just for us, but if we have kids at home or spouses, et cetera. There's financial stress for a lot of folks. I think, if possible, getting outside and as long as you're separated, some exercise is really important for your mental health. Even if it's as simple as a walk, it doesn't have to be anything crazy. Bike ride, a simple walk, things like that. I can tell you, I've started making walks a regular part of my routine, even if it's separate from exercise, just to find a little peace and quiet and get outside. So I think exercise as its part, not just for your physical sort of well-being, but for your mental well-being, I think is something that we don't want to overlook, because as that stress builds up, it also has an impact on your immune system and the rest of your health, and that's the last thing we need to kind of compound with what's going on physically. So I would advise everybody to make sure they're paying attention to their mental health. And I actually read an article recently that I thought really made a good point, and that was, find that one thing that provides you comfort, that one sort of healthy thing to provide you comfort. Maybe it's a funny TV show, or like I said, a quiet walk, or whatever it is, but find that one thing that you can use to kind of your go-to to kind of find that little happy place during these times.
Yeah, that's a really great point, because I think a lot of people focus too much on I don't want to get infected or exposed, and they don't realize that just being locked in a closet for weeks at a time is really bad for you. So I think that's a big deal. For people in my industry, or our industry that can or convert to make some of these non-medical grade masks, do you have any opinions or feelings on that? I know that I've heard different takes on it, and some people say they wear them on top of other masks, and some people say that they're maybe not as good. I was just curious from your end on weighing in on that.
Yeah, I think I think that's sort of still very much in flux, right? It still remains to be seen if this is going to be a part of public life when this is all over. So for people that are making them now, is this going to be sort of a 3-month or 4-month thing and burn itself out? I'm talking about from a public use standpoint. And so people that are making them, are they going to make a gazillion masks and then they're going to end up sitting in a box somewhere because people are going to lose interest, or not? I don't know the answer to that. I would say that I think it's reasonable to think for the next year, certainly come fall, winter, this particular fall and winter season, I think people are going to have a heightened anxiety about infection transmission. So there may be some increased utilization this fall and winter time. There have been some recent studies out on which materials, I'm talking about fabrics, which may be more effective. I'm talking about for non-medical grade masks, which kinds of materials. And I think the studies I've read are suggesting like 2-ply materials, for example, or masks where there can be a little gap between them, like a little seam where you can actually put for example, like a coffee filter, even something in between that seam that you can take in and out and then just wash the mask. And so there's something that's sort of disposable in between. So there's some different creative ways you can do it that will provide some benefit for the wearer. And so I think, there might be some value in that. I don't know how long that is going to be lasting in terms of, public use, but there's no doubt that there is some value in it. And I think perhaps during, again, fall, winter season, there might be more interest in that, and that part might be lasting. But I think it's probably unrealistic to think that, summer months, Americans are going to be wearing masks when they go to concerts and things like that a year or two from now. I think that's probably not likely. But I could very easily see in the fall and winter when people go to their doctors or stuff like that, or they're maybe a little under the weather, or a family member they might want to have a mask at home. I think that's not an unreasonable thing to anticipate. So it's possible. I think it's possible, and certainly there is some benefit both to the wearer in terms of spreading that. So if I feel like I'm under the weather and I'm at home, I want to put a mask on to prevent illness, not so much for myself because I already have it, but to spread to my family. There is some benefit in that for them, not so much myself. So from that perspective, use at home, there might be some value there.
Yeah, no, those are all great points. I appreciate that. And then, I think that everybody wants to do what they can to help, you know, and
Yeah.
and in that vein, is there, you know, other ways, like, is there a certain place that people can donate, or what's other ways that people can help, you know, the healthcare providers right now? Because I know we all feel a little bit, you know, like we don't know what to do to help, you know, when we're sitting at home and stuff. And other than obviously, you know, being supportive directly to if we had no have somebody in the family, but is there something that you know of that there are different ways we could help you guys with this
Yeah,
challenge?
I think it's a, I think, you know, there are a lot of, I have a lot of colleagues, again, in my specialty, I'm not on the front lines. I have a lot of colleagues that are really risking a lot being out there taking care of really sick people. And unfortunately, a lot of them are, you know, sort of inadequately supplied in terms of their equipment and gear. And they really are laying a lot on the line, a lot of nurses and frontline staff. Um, but I think from your industry standpoint, I think you have a really unique opportunity because, like you said, you touch a lot of different parts of the community. And, you know, obviously, a lot of businesses are really suffering through this crisis as well. And I think actually long term, you know, the mask part may or may not last, but I think the part that may come out of this that could be long lasting is really a refocus on public health. And I think from a t-shirt standpoint, I would love to see, and I would imagine a lot of people in public health would love to see that if we could pair messages on t-shirts, like for businesses, your local pizzeria or whatever, with a public health message that maybe has a twist of humor or nothing dismissive, but, you know, twist of humor, or maybe just even simple messages, you know, washing your hands, or if you're sick, stay home, or these little small messages on t-shirts that are sort of pairing a public health message with whatever entrepreneurial message or promotional message. I think that would be a great way as a reminder that would be more long lasting for the community, and also would promote public health. And so I think that pairing of public health messages that are both healthy for the community and a, you know, whatever promotional business message, I think from a, again, t-shirt, you know, standpoint, I think that might be an interesting way that would help healthcare workers indirectly, help the community, helps the business to let them, you know, show that they're also obviously a positive part of the solution here long term. So I think everybody would win in that standpoint in terms of pairing messages that helps everybody really.
Yeah, that's great. I think, you know, tying awareness into it is a key, because I think part of the challenge that we're facing right now is that awareness piece that has kind of caught people off guard. But I want to respect your time. Obviously, I know you're super busy trying to help everybody there, and yeah, I just really appreciate it, and look forward to talking to you again. So thanks a lot. Be safe, and I appreciate it. Thank you,
Thank you,
Amarish.
Tom, and you be safe as well.